Okay, welcome everybody to Exploring the Link Between Gambling and Poverty. Thank you so much for joining us today. I see a number of people are still joining, but I think we'll get started so as to not waste any time. I'm going to pass the teleconference over to my colleague Jess, who's going to give a brief introduction this morning. So Jess, are you there?
Great. Can you hear me?
Yep, we can hear you just fine. Thanks, Jess.
Perfect. So welcome again to today's webinar on exploring the link between gambling and poverty. My name is Jess Full, and I'm a knowledge broker here with the Gambling Research Exchange Ontario, or as we call ourselves, GREO for short. And if you're not familiar about what GREO does, we are an independent knowledge translation exchange organization, and we aim to eliminate harm from gambling. We do this through supporting evidence-informed decision-making and responsible gambling policies, standards, and practices. One of the programs that we fund are the GREO Knowledge Hubs, which are situated within Ontario universities and hospitals, and these are groups that have an existing foundation in gambling research activity. The Centre for Urban Health Solutions, housed out of St. Michael's Hospital in Toronto, and is the group presenting today's webinar, is one of our 5 funded hubs and is led by Dr. Flora Matheson, who is one of our speakers for today. Dr. Flora Matheson is a medical sociologist and mental health and addiction specialist. She's particularly interested in how gender inequities and other social determinants of health affect people experiencing complex health and social needs that span problem gambling and substance abuse, mental illness, poverty, housing instability, and imprisonment. Our other presenter today is Sarah Hamilton-Wright, a research staff hub member at the Center for Urban Health Solutions. Sarah works with Dr. Matheson on a variety of projects and coordinates the Gambling and Poverty Knowledge Hub. Just a couple other housekeeping notes. We will be holding the question and answer session at the end of the presentation today, so please submit your questions throughout the presentation in the Q&A area on the right of the slides. If you're having any technical issues, you can submit your questions there as well. And without further ado, I'm going to turn it over to Flora to begin the presentation.
Hi, everybody. My name is Sarah, and welcome to the webinar today. We're going to begin by, well, thank you, Jess and Melissa, for introducing us and our team, and we look forward to having you all joining us. I'm just going to introduce to you today the agenda of our webinar. You know what to expect. We're going to start today with some poll questions. And these will help us to get to know our audience a little better. We did say it'll be an interactive webinar experience, so we're going to begin with that. We'll then provide a background and introduction to our work in problem gambling, poverty, and homelessness. Flora will introduce our collaborations and our partners, as this is a very strong focus of our work. We'll take you through some of our research findings on prevalence rates and our qualitative findings. And we'll introduce some solutions that we're currently working on with our partners. And finally, we'll look forward to your questions, answers, and ideas at the end. Okay. And now, Flora's going to talk about our program.
Good afternoon, everyone. It's really a pleasure to have you all on board today at the presentation, the webinar. We're quite excited about the work we're doing here at the Center for Urban Health Solutions, or CS, and we're quite grateful to GREO for funding and also for helping us with this webinar. I don't think we would have been able to do it on our own, so they were very generous in helping us with that. So just to let you know a little bit about us, we are a center at the St. Michael's Hospital in the inner city, and we do a lot of work, or all of our work, the scientists at the center, we work with marginalized populations, so people who are experiencing homelessness, people who are experiencing poverty, people who are Indigenous people, and I work in the area of homelessness and problem gambling and also in prisoner health. And so we really are all are focused on solutions to alleviate health inequities for these populations. So I have a core team that works with me, and we are from many different disciplines, epidemiology, geography, social science, or sociology, neuroscience, And we also kind of span a different range of types of research. So we do health services research, we do qualitative work, we do quantitative work, and survey research, just to mention a few. We try to sustain a group of trainees so that we can really help to keep the work going in problem gambling, in the area of problem gambling, and to really train the next group of new scientists and new investigators. One of the core things in our team is that we really work very closely with a network of community partners. We really want our research to have an impact in the community and an impact on clients' lives. So that is always, when we start our research, we start with our community partners. And we collaborate with the University of Toronto, with Matheson University. Good Shepherd Ministries has been a long-term partner with us over 4 years. We've recently, in the last year and a half, partnered with the Problem Gambling Institute of Ontario, which is at CAMH, and we have several funders, as I said, GREO, the Ontario Problem Gambling Research Centre, which is now GREO, the Ministry of Health and Long-Term Care, and the Canadian Institutes for Health Research, as well as the Ministry of Housing. So we're grateful to our partners because we couldn't do this research without them. So with our program of research here and our KT activities at the hospital, we really want to build awareness, create solutions, and provide a training platform for new researchers. So we really want to build community and clinical awareness of problem gambling in the context of complex social, structural, and health issues, and we'll talk a little bit more about that later in the presentation. We want to develop responses to reduce the harms associated with gambling. So with our community partners, what are some of the solutions that we can build together that will help either service providers provide better service or implement new services, and what exactly can we help the clients achieve in terms of their health and overall well-being. And then it's really important for us to train students, because students come in with new ideas and new training, and they bring kind of a new focus to the hub. We try to engage with novel approaches to research and knowledge translation. We have engaged peer interviewers in our qualitative work to have them do the qualitative interviews with clients when we're doing studies, and that's really important so that we don't have a power differential between the interviewees and the interviewers, and it's also a way to build capacity in the community as well. We've used something called the World Cafe 3 times now, twice with youth and one with adults with service providers, which we'll talk about a little later. But it's a really interesting approach to bring people around the table in kind of a cafe-style environment and enable them to have small group conversations, and then to bring everybody together in larger group conversations, and to have people travel from table to table, so they're kind of seeding the conversation from a previous table to a new table. So it's really quite interesting, and an interesting way to gather research findings, which isn't used very much yet in the research area, in the research field. This last year, we had a community advisory committee, and you'll see their logos around the edge, and they were extremely helpful in helping us develop a couple of products, which we'll talk about later. And we are really indebted to them, because they're on the front line, or they're directors, and they understand even better than we do what's happening with their clients, and so that's been extremely useful. And then we also do evaluation of interventions. So when we implement solutions with a community partner, then we can evaluate it and look at metrics and see what needs to be tweaked, what's working well, and where the intervention may need to go in the future to help maybe other client groups.
And we're also engaged in evaluation with our KT work, which is a big part of why we're integrating some of these questions and polls throughout our presentation. So the next question that we are interested in presenting to you is we are wondering if you for those of you who do work with clients in your daily work, do you have conversations about gambling? And so if you could just answer if this is applicable for you, yes or no, and if it doesn't, just indicate not applicable. Okay, so it seems, so for those of you who are working with clients in your daily work, it seems that quite a lot of you are talking about gambling in some capacity in your work with clients. So that's an interesting finding for us to know. Thank you very much.
So back over to Flora, and really I want to give you a little story about how I got interested in this program of research. About 4 years ago, I was quite interested in problem gambling, and I was looking at the literature on problem gambling and homelessness, and there wasn't a lot there, and so I was really wanted to think about what could we do in order to understand the links between problem gambling and homelessness. And so I developed an idea to do a qualitative study and put a proposal together. I went to see Eklilu and Stephen and Kirk at Good Shepherd Ministries, and I talked to them about it, and they were interested. They're very progressive, and they like to implement programs where they see there are services that are not available. So they were quite interested. But they didn't know the prevalence of problem gambling in their population, so they really wanted to understand that first. And so we did a prevalence study with them. So I guess I should tell you the background of problem gambling before we get into the prevalence study. I'm just so excited about the prevalence study that I won't talk to you about it. So. So really, problem gambling describes individuals who are experiencing some adverse consequences as a result of their gambling, but they don't necessarily meet the criteria for a diagnosis of disordered gambling in the DSM-5. We know that problem gambling and disordered gambling and homelessness are global health concerns. There are millions of people that are suffering from both homelessness and problem gambling. And as I said, there's been little research that exists on this relationship and how best to provide services. So here we go. Now I can talk about the prevalence. So we did a survey where we went into Good Shepherd Ministries, and we went and talked to clients at different times of the day, different days of the week, and in different programs, so that we get kind of a wide berth of clients that we're seeing seeking services at Good Shepherd. So we went to the drop-in program, went to the DARE program, we went in during the day, in the evenings, we went on the weekends. And what we found out when we were looking at lifetime problem gambling is that 10% experienced problem gambling and 25% experienced pathological gambling. And actually 8 to 9% were at risk of problem gambling. So that's extremely high. It's 9 times higher than what is in what we see in the general population. So that was a bit of a shock for us, but also kind of gave us some impetus to say, okay, now we need to understand what that relationship is between problem gambling and homelessness.
Okay. And Flora has just introduced these findings on prevalence rates. And we are very interested in your impression of these findings. So if you could answer in our next poll, what is your impression of the findings on prevalence rates? Are you, for example, not surprised, somewhat surprised, or very surprised? Or maybe you're not sure. No. Okay, so our results are in, and it shows that many of you aren't surprised, so you did suspect that gambling was highly prevalent in the clients that you are working with daily, and others are somewhat surprised. So you had a notion it was a problem, but maybe not quite so high. So that's very helpful for us to know. Thanks very much for answering. So I'm going to talk a little bit now about some of the findings from our qualitative study. So Flora had introduced the prevalence study, and because those findings were quite so striking, Flora embarked on the next phase of this research, and so she and her team conducted a qualitative study that explored men's experiences of housing instability, homelessness, problem gambling and mental health concerns, including their experiences or need for services. And this was conducted in partnership with Good Shepherd Ministries in Toronto. We took a participatory approach to conducting the research. And 30 men were recruited from the original Prevalence study to take part in an in-depth qualitative interview. And as Flora had mentioned earlier, we engaged peer interviewers in the research. So the 3 peer interviewers worked on the study. They had lived experience of housing instability, addictions, or mental health concerns, and just had a wonderful ability to relate and connect with the experience of the participants. They were provided with comprehensive training by the Survey Research Unit here at St. Michael's Hospital. You can read a little bit more about it if you are interested in the publication that's listed at the bottom of the slide. And so, yeah, it was just the next phase of the study. Then we did start to analyze some of the qualitative data that came in. And we can tell you a little bit about the profile of the participants. So most men had experienced trauma in their lives, complex trauma. For example, childhood abuse, early homelessness, poverty, a lack of informal social supports. Most, again, about 80% of the men were unemployed at the time of the interview, and therefore many men were relying on social assistance for their main source of income. And this comprised, for example, disability assistance, employment insurance, Ontario Works was common. Men described many pathways into problem gambling. So they talked about poverty, often as a result of losing work due to illness, injury, or other reasons. Many men spoke about bereavement, so a loss of a significant other person in their life, whether it be a child, a family member. Sometimes this was also as a result of a relationship ending in their life. Many ended up on the pathway towards problem gambling in response to disability. It was often interconnected with substance abuse, including alcohol abuse or drug abuse, for example, and many had coexisting mental health concerns. So they did describe these multiple pathways that also were connected with their experiences of homelessness. When we looked a little deeper into the findings, it became apparent that a majority of the men experienced complex experiences of adversity in their early life. So 20 of the 30 men described to us that they began gambling in their youth during complex situations of trauma and adversity. Again, these were things like childhood abuse, either physical, emotional, or sexual abuse, early homelessness, so running away from home or being out on their own before the age of 18, for example. They often had to engage or chose to engage in criminal behavior in association with their gambling activities. And the following the quotation that you'll see on the slide is an example from one of the participants who talks about his early life. He says he's always moved around in different places, all over the place. His parents who drank didn't pay the rent, and he lived a rough life as a kid. Anywhere he lived, it really, in his words, screwed his life up. He went to many schools, and he would have to go to school in dirty clothes, and it affected his self-esteem. Other men talked about this feeling of low self-esteem and turning to gambling often to kind of fill a role. It was something that they felt good at. They got some attention for. They often were using gambling activities to, in their mind, earn money to help them in the impoverished situations that they found themselves in, unfortunately. And again, you can read more about that in a paper that we've published. It's listed at the bottom of the slide. For many men, gambling and substance use coexisting together was a tipping point for homelessness. And they often talked about how quickly that escalated for them. The quotation that we've provided on the slide, again, is another example of how one of our participants talked about how he was homeless. And so again, he had a slow year at work, and then he engaged in gambling and drinking together and ran out of money. And for him, it was just very disturbing how easily it happened. And he does acknowledge that if he hadn't drank and gambled together, he would have been able to have a home, in his words. So, in other words, it is very important for us to look at these coexisting issues because they are risk factors for homelessness.
And just to add to that, we've seen in the literature that there is a strong correlation between problem gambling and substance use, as many of you probably already know. And so it does present a particular problem for people with relation to homelessness. And one of our participants talked about how close they were in terms of his relationship with problem gambling and substance use, where he said that it was him in the middle and substance use on one side and problem gambling on the other, and they were walking down the road together. So it really, problem gambling has its own relationship with homelessness. Substance use has its own, but they're also interconnected, those three issues. So I think that's important to think about in our research and as we provide services. So thinking about services, we did ask quite a few questions of the men on service delivery and where they access services, and if they knew about services. Some of them didn't know about services. Some of the other issues that the concerns that they talked about were that there's not really standalone services for problem gambling, so if they didn't want services for homelessness or other issues or concerns, that there wasn't someplace they could go with just standalone services. Now that may just be because they aren't aware of the services that are available in the city, or that there's no referral system. Maybe service providers aren't aware either, and that, especially in the shelter or housing system, and that makes sense because sometimes we deal with health concerns and mental health concerns separately rather than as an integrated service. So these men just really weren't aware of any standalone services. They also said there was little integration of problem gambling into other service delivery approaches. So really talking about that wraparound approach, so that it's a kind of one of the men talked about a one-stop shop where they could go and get help for all of the concerns that they had. They also talked a lot about client-centered care. So they really wanted to participate in their own recovery and be active participants in treatment planning and self-management. That was that came out loud and clear during the interviews and when we analyzed the data. So one of our papers is called Talk With Me, and the reason we called it that is because one of the participants said that when service providers are talking to them, he wanted them to talk with him and not at him. So if they're talking at him or at me, as he says, not with me, I'll stop communication right away. I'll say, look, you're talking at me, talk to me, talk with me, but don't talk at me, don't talk down to me. So it's really about providing services where the client is kind of the center of the service and that they're part of their recovery process. And that should stay in terms of what services they would like and how those services could be delivered. It's a big bill, I know. The other kind of theme that came up in our analysis was really around a tension between autonomy and can't find the right word, but finding the right balance between, having their own freedom to, say, manage their own financial situation or their finances, but having support so that they can actually be financially stable. And so, one man was talking about if you really have to hold someone by their hand, then you should do that and really take them through the process and navigate for them so that, if they need to have a trusteeship or something, so really to make sure that they are able to pay their rent and able to meet those primary financial responsibilities, just so that they are stable in their housing. So how much money they're throwing away, they grab a $1,000 check and the next day they're gone. In service delivery, what happened, I gambled it all away, or I smoked crack all night and I'm broke. So really about the self-management piece versus the kind of the management by an external person to help them with their finances. So I spoke earlier about the World Cafe, and I wanted to talk to you about, excuse me, the World Cafe we did with service providers. And this was done in November 2014, I believe. So some of the issues or concerns that were talked about by the men in the Qualitative Study also came out during the World Cafe. So we had about 16 people at the World Cafe. 2 of them were clients, which was really wonderful to have them in the room with us. And these are some of the main themes that came out during that discussion, that half-day discussion. Service providers were unaware of problem gambling among their clients. This was so we had people from the mental health system, from the substance use system, from problem gambling, from public health, from the criminal justice system, and from housing and shelter. So, you know, during that conversation, we heard they were unaware of problem gambling among their clients. They really needed some resources so that they felt like they had the knowledge and the training to address problem gambling. We also heard from the lone physician in the room that that physicians are uncomfortable screening and engaging patients with problem gambling in their practice. And then we also heard that peer support workers are really essential in the care and recovery of people that are experiencing these complex issues. So how are we responding to this? We are really excited that we collaborated with CAMH, the Problem Gambling Institute of Ontario, and with Good Shepherd Ministries, and had funding from the Gambling Research Exchange Ontario and Ontario Problem Gambling Research Centre, and we have created a training manual for service providers across sectors. So it could be in the shelter or housing sector, it could be with family physicians who are interested in starting conversations about problem gambling with their patients. We're really excited. I believe we are hoping that it'll be available early April. Well, it will be available early April as far as we know. And it's being printed at this moment, and really excited. And CAMH has taken on the role of printing this for us, and also helping with the cost of an illustration. And you can see the illustration on the front page there. It matches some of the. It's similar to the illustrations they already have in their other training manuals, and it was done by a Toronto artist called Joe Fleming. So we're quite excited about this, and if people are interested, we will hopefully have a PDF to send out shortly, and Melissa can send that out to the participants on the website today. We did pilot it in 4 Ontario cities. So the way we built this manual is that we did focus groups. We talked to a consumer client focus group. We talked to service provider focus groups in Kingston, Toronto, Hamilton, and Windsor, and we got their input on what would be needed in terms of the content of the manual. We also did an environmental scan to see if there was any information available already, and there wasn't on problem gambling and poverty. And we also, and then we pilot tested it in the same 4 cities, and just got more information on the content and the format and what else was needed. So we're really excited, and it's been a great, great partnership.
Yes, it has.
And we're also excited, too. We've developed a new website. It's not yet available. It probably will be available around May. It's hosted on the Problem Gambling Institute of Ontario CAMH server. But it's about the Problem Gambling Hub here at the center, of which they're a part. And so this will provide, there'll be connections to the manual, and we'll continue to upgrade this and put more information on this as we learn more with our community partners about problem gambling, poverty, and homelessness. So we'll let you know when that's going to be available, but we're thinking probably in May. And then it's a resource that you can go to. Many of you are probably familiar with the Problem Gambling Institute of Ontario websites, website, and this will be part of that whole format and platform. So we're quite excited about that as well.
And hope you'll visit the site. Thanks. Great, so thank you, Flora, and thank you all for joining us today to learn more about all of these important issues and concerns and what we're working on to help address them. We're going to have a question and answer period in a few moments. Just before we do, we would like you to participate in a few more questions. There's 4 or 5, I think. It'll help us evaluate the webinar, and it'll only take a moment. So Melissa's going to provide them, and we're hoping that you can answer them quickly. We won't be broadcasting or publishing, displaying the results, so your answers will be kept anonymous, unlike the previous polls. So if you can just take a few moments and go through them, that would be great, and then we'll go straight through to question answers and ideas.
We do have a question about what type of gambling were the participants involved in? And I'm assuming that's for the Prevalence study.
Yes, so a lot of the gambling is scratch tickets, but it really could be anything else, including, gambling at the casino. And remember that some of the clients gambled early on and lost their homes, and some of them started gambling after. So some of them started gambling before they lost their homes, and some after. So it's really any type of gambling, but scratch tickets is quite popular, and also casino gambling. But some people talked about going to the racetrack as well. So it's a real kind of mismatch.
There's a few questions about the webinar being recorded. So yes, it's being recorded, and as soon as this is done, I'm going to process it, and I'll put it on the GREO YouTube channel, and that link will be sent out with the guide when it's ready. Or you can just check back later today on our channel for the recording. Another question about the guide, is it going to be available in French as well?
Not at this time, but that's something that we can consider with some additional funding. So at this time, I can't say that it will be. It's just in English at this point in time. But thank you for that question.
Okay, great. A good question is disordered gambling the same as pathological gambling? And when you use the term problem gambling, does it encompass both problem and disordered gambling?
There's a lot of terms out there about gambling. Disordered and pathological are used interchangeably. Problem gambling, as I said earlier on in the presentation, it doesn't meet the criteria for pathological gambling, the Diagnostic Statistical Manual, version 5.
Okay, great. Someone asked if we can get a copy of today's slides. Is that something we can send around as well?
Absolutely.
Okay. We have maybe a question and a statement, but someone says, I'm concerned about children of problem gamblers and how they cope. Do you have any comments, or do you want to point them to the CAMH Guide for Families, perhaps?
I think that's a good idea. I'm concerned about that as well, so is my team. Some of my team is working on youth gambling and delinquency, so it definitely is a concern. And as you say, Melissa, PGIO does have a manual that covers some of that. But if you need more information, we can probably help you with that as well.
I'll try to grab that link to the guide and post it in the chat in just a second as well.
And sorry, CAMH also has a resource for professionals as well as families.
Okay, I'll post both those links as well. We have a question about tension with autonomy. Could you talk a little bit more about that? What are the barriers and how can they be overcome?
I think this is a difficult one because it's there may be some resistance to having someone kind of take control someone's life in terms of their financial management. So I think that it's a really good question, and I'm not sure that I have a particular answer to it at this point in time, but I think it's something we need to explore a little bit more. I think it's really about the conversation between the service provider and the client and why that may be needed, but also providing some way for them to feel that they have a stake in their own recovery. So when I talked about, talk with me, not at me, and being part of the recovery process, maybe it's a conversation about, well, I think these are the things that you could self-manage, but maybe these are other things that we need to talk about, whether you need some help with this. At this point in time, that's what I'm thinking of. I'm sure my partners at CAMH might have some other ideas that they could offer for you.
Someone was asking if a list of citations could be circulated from the presentation.
Yeah.
Okay. There's a question about how can I obtain a copy of the new manual when it's available. So I just want to reiterate that I will send out an email to all the participants with the slides, with the link to the recording of today's webinar, and a link to the guide when it's available. So I would say look for that in about a week or so. From what I understand, it's currently in design, but it should be back next week. So that will come as soon as it's ready. Another question is, your qualitative study looked at men only. Are there plans to explore the relationships between gambling, poverty, homelessness among women?
Absolutely, yeah. Absolutely. We've submitted a grant to the Social Sciences and Humanities Research Council of Canada, and we'll know mid-April if we have the funding for that, but it's definitely on our radar because we really, we think that that's a missing link here in the Canadian context. So yes, we are definitely planning on that, and we have some community partners already that are quite interested in that. And if anyone is interested in talking to my team about that, please do get in touch.
Great. And have you found any studies on gambling and homelessness in any other countries? And what, if so, what treatment are they providing?
Oh, treatment. I'm not sure about the treatment piece, but we can, if people want to know about that, we can probably help find some of that information. But yes, there was another study, and I should have mentioned this earlier, there was another study in Quebec several years ago that found a similar rate to problem and pathological gambling among community service users. And then there's been an epidemiological study in the U.S. by Nauer, N-O-W-E-R, and it was, they found a slightly lower prevalence of problem gambling. And then there's been a study by Sharman, S-H-A-R-M-A-N, in the U.K. that's found, I think, a similar rate. In terms of treatment, I can tell you about something that's happening right now that's new. The Good Shepherd Ministries is currently developing a problem gambling case management approach for their clients, and it's just in its implementation stage. And you will probably be hearing from them because they're doing outreach because we have they have funding to implement the program, and then we are the third-party evaluators who are going to be helping them evaluate that program. So we're really quite excited about that. I really don't know of any other shelter that's doing that. If someone knows of another shelter that's doing something like that, or another housing within the housing sector, I'd be really happy to hear about that.
Great, thanks. Here's a great question. So, do you have any evidence comparing harm reduction versus abstinence approaches for the treatment of problem gambling?
That's an interesting question, and I off the top of my head, we don't have research on that, and I'm not sure whether there's research out there, but it's a really interesting question because, as we know, it's really difficult to stop gambling, and it's difficult to stop using drugs and alcohol. It takes a long time. I think it's an average of is it 9 or 20 years from, the initial kind of trying to stop to when you actually achieve that. So the recovery process is up and down with relapses, and so abstinence, I think, works for some people. It may not work for other people, and it may take a while to achieve abstinence. So I think those pieces, in terms of research on that, is quite interesting, and I actually don't have the facts on the top of my head unless Sarah does.
I don't have the facts.
But there is Gamblers Anonymous, and so with Gamblers Anonymous, it's abstinence-based. Not all of the anonymous programs are abstinence-based. Some of them, will accept people without requiring the abstinence piece. So I think it depends on the person, and I don't have specific research on it, but it's really an interesting question.
Okay, just a plug for GREO here. We have we have a database which we've renamed the Evidence Center with the launch of our new website, which is actually happening next week. So there is a ton of research, so both plain language resources, gray literature, even data sets based on information about reducing harm from gambling coming from research. So you can visit our website, GREO.ca. It's free, and you can do basic and advanced searching for topics like that. So just wanted to say that. So I think maybe we'll have time for one more question, which I think actually we've addressed pretty much all of them. Just a quick note, actually, that, well, I'm not going to be able to pronounce that, SILOAM mission. So the homeless shelter in Manitoba is looking at creating something to help problem gamblers, and they're meeting with Shannon next week to begin the brainstorming phase. So thanks for sharing with us, Shannon. And I don't know if Shannon, you might want to connect with Flora and Sarah in the hub if you are looking for more information on that. So final question, can you just let us know who you share your findings with, Flora and Sarah? Ruth was just saying that, do you share with OLG, for example? Thinks that this is great information and it's based in evidence. So I thought maybe you could just let us know, who you share your findings with, so that we can answer that question a bit more broadly.
Yeah, so we have had meetings with OLG, and they're quite aware of all of the programs within the hubs across Ontario, the 5 hubs, including ours. So they are aware that we're doing work in problem gambling and homelessness. We share as broadly as we can. I think now with the manual, we'll be able to share even more because it's virtual, which is great. But we have reached out to the community. We'll do more of that. If there are places where you think we should share this information, we would be happy to go on the road and talk to people. That's not a problem at all. So we share widely, and with the website, I think that's going to help with the sharing, and as I say, the manual will help with the sharing as well.
Yeah, and we've been working at publishing the research in peer-reviewed journals, and hopefully we can continue to take some of that evidence and mobilize it in different ways and different formats to various audiences. So that's something that we're hoping to do next year and beyond. And GREO has been really helpful in educating our team on how to message appropriately and how to broaden our reach of our work.
And we do sometimes have summaries on the Homeless Hub as well of some of our work. Okay,
great. So I believe we've addressed all the questions that have come in. Just taking one last look. Yeah, I think we've done a good job of addressing all of them. If anybody has any further questions, though, you can email them to me, Melissa, MELISSA @greo.ca, and I will definitely forward to Sarah and Flora for their response. But I wanted to thank everybody on the line today for joining us. Also, most people have stuck around for the question and answer. I think that was a really interesting part of the presentation, so thank you so much for attending today and asking lots of great questions. And Sarah and Flora, thank you so much for sharing your research, sharing what your hub does, and for being open to sharing all the resources that you can. So thanks for your time today. And we were really looking forward to sharing the guide with everybody and seeing how it is implemented in your work. So any last comments, Sarah or Flora?
Well, thank you, Melissa, for hosting, and Jess for the introduction, and to GREO. And thank you, everybody who has an interest in this topic. And please do reach out to us if there's anything that you want to discuss with us or other questions that you have. Yes. We're more than welcome. We welcome you.
Yes.
Yes.
We'd like to hear your ideas, and it's great. Thank you very much.
Okay, great. Well, everybody have an excellent day. I know it's cold, but enjoy the sun that's hopefully shining where you are. And we will send out all the resources as soon as we can. So have a great day. Thanks, everybody.